Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of ENT is the laryngeal paralysis and trauma. This topic we will discuss in 5 sections. In the first section, we will talk about the paralysis of the larynx caused by the superior laryngeal nerve paralysis. And then we will discuss about the nerve supply of the larynx. Causes of laryngeal paralysis, in this case, the causes of superior laryngeal paralysis specifically, and also the unilateral and bilateral type of laryngeal paralysis caused by the superior laryngeal nerve paralysis. Then in the second section, we will talk about the recurrent laryngeal nerve paralysis. What's the unilateral injury or unilateral paralysis as a result of recurrent laryngeal nerve involvement? What's the bilateral abductor paralysis, and also what are the different treatment options for the recurrent laryngeal nerve paralysis? Then in the third section, we will talk about the combined laryngeal paralysis, in which we will talk about the unilateral and bilateral paralysis when both the superior laryngeal and the recurrent laryngeal nerves are paralyzed. And what's the treatment option? In this case, mostly total laryngectomy and diversion procedures. We will discuss those procedures also. Then in the fourth section, we will talk about the congenital vocal cord paralysis, unilateral and bilateral, phonosurgery. Phono is the word used for the sound, phonosurgery, and then thyroplasty and laryngeal re-innervation procedures. Then in the fifth and final section, we will talk about laryngeal trauma, etiology and pathology, how the laryngeal trauma can lead to the paralysis, and then different effects on the trauma on the sound production, diagnostic evaluation, and also the conservative and surgical treatment of the laryngeal trauma. So all this will be discussed in our today's lecture, laryngeal paralysis and trauma. So keep watching sqadia.com to learn about this topic.